So my name is AJ Mack, and today I'm going to be talking about polycystic ovary syndrome. So polycystic ovary syndrome, also known as PCOS, is a hormonal condition in which the ovaries of a female's reproductive system is overproducing a hormone called androgen. This overproduction of androgen causes irregular ovulation, irregular periods, fertility, and mood changes, as well as other problems. PCOS affects approximately 6 to 13% of reproductive aged women. And in the picture to my right, here's a picture of a normal ovary, and then here is a picture of a polycystic ovary. So, symptoms. Some symptoms are infertility, excess levels of androgen hormone, irregular periods, hirsutism, which just means excess in hair growth, typically like a man would. The other symptoms are acne and weight gain. Causes and molecular mechanisms responsible for PCOS. Although the cause of PCOS is still a mystery, there are certain genetic and environmental factors that can influence that play a role in having PCOS. Factors do include heredity, low-grade inflammation, excess androgen hormone, obesity, and insulin resistance. Low-grade inflammation just means that the body is slightly inflamed, and that low-grade inflammation can increase insulin resistance, worsen hormone imbalances, contribute to weight gain, and it can also affect ovulation. Now, excess androgen hormone, having too much androgen can inhibit with ovulation. Androgen is primarily a male hormone, and for insulin resistance, if the body doesn't use the insulin correctly, it can lead to higher insulin levels and more hormonal imbalances. Symptoms are more common in people with obesity. How do we figure out the diagnosis? So your first step in figuring out the diagnosis of PCOS would be making an appointment with your doctor to discuss the symptoms and how medications or medical conditions are affecting you. Step 2 is a physical is going to be conducted, and based off of that physical, which is going to move on to step 3, the doctor might recommend one or more of the following exams. So your doctor could recommend a pelvic exam, which the doctor inserts their gloved fingers into the vagina while pressing on the lower abdomen, which is done to check the size and the placement of the ovaries in the uterus. A blood test, or blood is drawn, usually from a vein in the arm, and then the blood is sent to the lab for testing. Usually, the blood tests that are done are SHB, which is usually low in PCOS, LH and FSH, which PCOS causes a high ratio in the two. And then finally, the final test would be the ultrasound, in which a transducer is inserted vaginally to check the appearance of the ovaries. The transducer uses the sound waves to create pictures of the reproductive organs, which is done to check the appearance of the ovaries. Step 4 is, if PCOS is detected, more tests can be recommended by your doctor. Different tests such as blood pressure, glucose tolerance, screening for depression and anxiety, as well as cholesterol level testing. So the current treatment approaches are, here are a few, weight loss being the main one. With weight loss, ovulation can be restored and insulin and cholesterol levels can be improved. And when your ovulation is being restored, that helps your menstrual cycles become more regular. Oral contraceptives / birth control. Birth control containing estrogen and progestin can be used to regulate the menstrual cycle. This is also an effective treatment for women with PCOS who don't want kids. Insulin sensitizing agents. So these medications can keep glucose levels steady and help the body respond better to insulin. With medications helping, the insulin sensitizing agent medications can help clear up acne, it can improve weight loss, it can regulate periods, and also reduce infertility in women with PCOS. And finally, we have anti-androgens, which is a medication that can limit the effect of androgens, which is primarily a male hormone. For recent research advances in PCOS, GnRH antagonists are drugs that stifle the releasing of FSH and LH hormone. It was mentioned that during phase 2 that elagolix solely is an effective treatment for women with PCOS. Sodium glucose co-transporter type 1 and 2. The insulin resistance treatments have been shown to help and lessen PCOS symptoms by managing glucose levels. FSH and LH are hormones that are usually high in women with PCOS, and with it being able to be controlled, it helps lessen the symptoms of PCOS.